Good evening, friends. Today I am here to talk about myopia. Myopia or nearsightedness or short sightedness is a very common condition for which we are prescribed concave spectacles. So, myopia definition is it is a type of refractive error where the parallel rays from the infinity focus in front of the retina and accommodation is at rest. So because of this, the blurred image is formed, and we are only able to see whatever is near us, but whatever is far from us is very blurred. Now let's talk about the etiology of myopia. Axial myopia is the most commonest type. It is the increase in the anterior-posterior length of the eyeball, and it can occur pathologically or it can occur physiologically. And 1 mm increase causes 3 diopters of myopia. Curvatural myopia is due to increased curvature of the lens, the cornea, or both. 1 mm decrease in the radius leads to 6 diopters of myopia. Positional myopia is due to anterior placement of the crystalline lens. Index myopia is increase in the refractive index, so more refraction takes place and the image is formed before the retina, and this is usually associated with the nuclear sclerosis of the lens. And myopia can also occur due to excessive accommodation. So there is a spasm of accommodation, the ciliary muscles are contracted, the zonules are relaxed, and the lens becomes more curved, and the spasm takes place, so they are not able to return to the normal position. This leads to myopia. Grading of myopia. According to the American Optometric Association, low myopia is from 0 to 3 diopters, moderate myopia is from 3 to 6 diopters, and high myopia is greater than 6 diopters. And in the next slide, I will be talking about the types of myopia. So, high myopia is usually the congenital type or the pathological type, and low and moderate myopia are seen in the simple type. So, there are 4 types of myopia: congenital, simple, pathological, and secondary. Congenital occurs from the birth. Simple is occurring in the school going age from 5 to 15 years of age when the person develops myopia due to normal biological variations. It's not because of any disease. Pathological myopia, unlike what the name suggests, it's not because of a disease. Pathological myopia is the overgrowth of the eyeball. It's not under normal biological variations. Secondary myopia is because of diseases. It is caused secondary to diseases. It's also called as acquired myopia. Congenital myopia. As you can see on this picture on the left, the light rays are not focusing on the retina but instead on front of the retina. This defect is called myopia, and when it's present from birth, it's called congenital myopia. It is important to diagnose it early because we can prevent amblyopia. What is amblyopia? Amblyopia is when the one eye is less functioning than the other eye because it received less stimulations from the external environment. The magnitude to which congenital myopia can progress is up to 8 to 10 diopters of myopia, and it is usually associated with anisometropia and convergent squint. Squint occurs because of excessive accommodation, and it is also most commonly associated with anomalies like microphthalmos, aniridia, megalocornea, and congenital separation of retina, and the fundus examination reveals a myopic crescent. When we go to pathological myopia, I'll explain more in detail about the myopic crescent. Now let's go to simple myopia. Simple myopia occurs in the school going age, 5 to 15 years of age. It does not occur due to any disease. It is a physiological error. So the mechanism of simple myopia, it is the normal biological variations due to which the eye is more bigger than usual. It can be axial type or curvatural type, and curvatural type is due to underdevelopment of the eyeball. So some of the predisposing factors or the risk factors are genetics, diet, limited outdoor activity, and TVs and phones. So when the diet is not normal, it's lacking in vitamin A, it can lead to simple myopia. And if both the parents are having myopia, there is a 20% risk of child having myopia. If one parent is having myopia, then there is a 10% risk of child getting myopia. And if the parents don't have any myopia, then still the child has 5% chance of getting myopia. And if there is limited outdoor activity and the child is more addicted to phones, TVs, then because of the eye strain, it can cause myopia. Clinical features of simple myopia. First is poor vision for distance. They are not able to see the distant objects very clearly, and when this happens, the child tries to overcome this by accommodation. So when there is continuous usage of ciliary muscle, we get symptoms like headache and tiredness. This is called asthenopic symptoms, and the child realizes that they have better view by shutting their eyes partially. This is also another symptom. It's called half shutting of the eye, and there is a change in the psychological outlook of the child. If it's an extrovert child, it becomes introvert. He or she becomes introvert, and they become more studious, and very little interest in the outdoor activities will be there. Now let's go to the signs of simple myopia. There will be prominent eyeballs, anterior chamber will be deep, pupil will be large, and it will be sluggishly reacting to light. Magnitude and progression of the myopia can be 0.5 diopters every year from the age of onset till about 21 years. Usually it does not cross 6 diopters. And sometimes exophoria may be there. Exophoria is when one eye is normal and the other eye is drifting outward, and there is a difficulty in coordinating both the eyes. Pathological myopia or degenerative myopia or progressive myopia is when the myopia is so progressive that when it starts from childhood and reaches the adult, it crosses 6 diopters, and it is usually associated with degenerative changes of the eye, and it is very less common when compared to simple myopia. Now let's go to the etiology. Genetic factors and general growth processes play a role in increasing the growth of the retina. Because of the increase in the retinal growth, sclera also grows along with it. Now when the retina and the sclera grow, the choroid tries to grow as much, but it cannot grow as much, so it undergoes degeneration. And then retina undergoes degeneration, and the vitreous also undergoes degeneration. And in total we have an increased axial length with degeneration of choroid, retina and vitreous. This is the features of pathological myopia. Pathological myopia can be genetic. So it is passed down as autosomal dominant and X-linked recessive type, and it is more common in women, and it can be familial. Symptoms of pathological myopia are defective vision, difficulty in night vision, floaters. Why does floaters occur? Because of degenerated vitreous. So when there is degenerated vitreous, you can see black opacities in front of the eye. And then there will be photophobia because the pupils are large, so more light enters the eye, and so there will be photophobia, and flashes of light may be there occasionally. These are the symptoms. Then the signs of the pathological myopia are prominent eyeballs, cornea is large, anterior chamber is deep, pupils are large and react sluggishly to light, and the magnitude of the refractive error is from 10 diopters to 40 diopters, which is a very huge error. Then fundus examination can show myopic crescent in the optic disc, near the optic disc. Degenerative changes in the retina and the choroid include chorioretinal atrophic patches near the macula. There are white patches near the macula, as you can see in that picture, and then Foster-Fuchs spots. Foster-Fuchs spots are red circular patches, and this is because of choroidal hemorrhage and subretinal neovascularization. And then you can see some black degeneration in the periphery, that is called cystoid degeneration. And then you can see some tears near the optic disc in the retina, that is called lattice degeneration, and there will be total retinal atrophy also. And you can also see posterior staphyloma in some cases. Posterior staphyloma is because of the weakness of the sclera as it is overextended. Lastly, degenerative changes occur in the vitreous cavity. Liquefaction of the vitreous and opacities in the vitreous are seen. This leads to floaters. Then visual field shows a contraction, so there will be ring scotoma, and electroretinogram shows subnormal electroretinogram due to chorioretinal atrophy. Complications of pathological myopia include retinal detachment, choroidal hemorrhage, complicated cataract, vitreous hemorrhage, and primary open angle glaucoma. Here I want to explain about myopic crescent. In pathological myopia etiology, I said there is the growth of retina, and then there is the growth of sclera, and then there is the growth of choroid, but choroid is not able to grow, so it undergoes degeneration. That's what happens here. You can see that the first line, this one is the sclera, and the second line is the choroid. So that's what causes the temporal myopic crescent in the fundus. Now let's go to secondary myopia. Secondary myopia or acquired myopia is caused by diseases, and the first type is the index myopia. It's because of increase in the refractive index due to diseases such as diabetes, nuclear sclerosis, and incipient cataract. Curvatural secondary myopia can be due to corneal curvature or lenticular curvature. Corneal curvature is increased in cases of diseases like keratoconus, and lenticular curvature is increased because of diseases like lenticonus anterior or lenticonus posterior. Then positional secondary myopia occurs because of anterior subluxation of the lens, and consecutive myopia can be because of overcorrection of hypermetropia in surgery or inserting the intraocular lens which has more power than required. That's called pseudophakia. Then pseudomyopia means that artificial myopia or accommodative myopia. Because of accommodation there is myopia. Myopia of prematurity. Myopia of prematurity can occur alongside the retinopathy of prematurity or it can occur after the treatment of retinopathy of prematurity. Then drug induced myopia occurs because of usage of steroids, sulfonamides, and cholinergic drugs. Treatment of myopia. Myopia can be treated by giving concave lenses in the form of spectacles or contact lens. Contact lens is used when there is a high myopia up to 10 to 40 diopters. At that time, if we use spectacles, it can cause peripheral distortion and magnification of the objects, which means the objects appear smaller than the normal. Then there can be surgical treatment and low vision aids. Low vision aids are used when there is progression of the myopia to such an extent that also involves degeneration of the myopia. So we cannot correct it by giving intraocular lens or spectacles. So in that case we use low vision aids. As you can see in the above picture and in this picture, it magnifies the images and we can read it after that. There are a lot of surgeries for myopia. The most common one is the LASIK surgery, that is laser assisted in situ keratomiliosis. In this LASIK surgery, first the cornea is numbed by giving an anesthetic, then the corneal flap is created, and then laser is given to reshape the cornea, and the cornea is made more flattened. When the laser treatment is complete, the corneal flap is replaced and the surgery is complete. This can be used to correct up to 6 diopters of myopia. Thank you for listening to this video. If you like the video, please like, share, subscribe and comment on it. Thank you.